Hello everyone. In this video, we are going to study the posterior part of Norma Basalis. We are going to divide the posterior part of Norma Basalis into median area and the lateral area the way we did in the middle part of Norma Basalis. Okay, so let's start. The structure which you can see on the screen is the posterior part, not just the posterior part, it is whole Norma Basalis. And let me outline the posterior part of Norma Basalis. See here. This is the outline of the posterior part of Norma Basalis, which comprises two bones, the temporal bone and the occipital bone. Okay. Now, we will divide this outline into three parts. The central part, the median part. Can you see the median area? Yes. Now we have the lateral area, which is present on both the sides. This is the lateral area. Now, first we will discuss the median area. What are the structures, important structures present in the median area? Please see. The median area shows, first is foramen magnum, then external occipital crest, then external occipital protuberance, and last the nuchal lines. Let me show you on the diagram. Here you can see the foramen magnum. Okay, then you have this external occipital crest, and here you have external occipital protuberance, and both the side you have the nuchal line, about which we are going to study now. These are the structures which is present in the median area. Now let me explain you foramen magnum, which means great. Magnum means great. It is the largest foramen of the skull. Let me show you here. This is the foramen magnum. Okay, can you see on the screen the foramen magnum? And let me show you, it opens in the upward region. The foramen magnum opens upward into posterior cranial fossa. See, cranial, whole cranial fossa, there are three cranial fossa: anterior cranial fossa, middle cranial fossa, and foramen and the posterior cranial fossa. So posterior cranial fossa is the space in which foramen magnum opens in the upward direction. You can see here. This is the, let me outline this part. This is the upward of foramen magnum, and this area is known as posterior cranial fossa. Okay, now let me show you how it, where it the downward, it opens downward into vertebral canal. You can see here in the another picture. This is the opening of the foramen magnum, which you can see here, this part. Okay, and here you can see the vertebral canal, how the foramen magnum is opening in the vertebral canal. Okay, this is the foramen magnum, and which opens downward into the vertebral canal. Okay, now let's focus on the foramen magnum shape. When you see the shape of the foramen magnum, it is oval in shape. How does it look? It looks oval in shape and wider in the posterior part, while narrow in the front part or anterior part. Am I clear? And on both the side you have occipital condyle. This is occipital condyle. Okay, after this we will discuss about the crest. External occipital crest, which starts from the foramen magnum and reach till external occipital protuberance. Here is the external occipital protuberance. Okay, what is external occipital protuberance? It is the projection which is located at the posterior end of the crest, and it can be easily felt. It is that point where the back of neck becomes continuous with the scalp. When you will feel the back of neck, it becomes continuous with the scalp. At which point? At this point, external occipital protuberance. Okay, after this we will see the nuchal line. Can you see the nuchal line here? Let me show you. There are two nuchal lines which can be seen on the skull: superior nuchal line and inferior nuchal line. Let me show you. This is the superior nuchal line, and here you have the inferior nuchal line. Okay, so both the nuchal lines are, we have one more nuchal line known as highest nuchal line, which is little faded and it's not always seen. It can be seen only occasionally. Now we have completed the median area. Now we will jump into the lateral area. The lateral area shows some of the structure like condylar part of occipital bone, squamous part of the occipital bone, and the jugular foramen, styloid process, and mastoid part of temporal bone. Let me show you here. Lateral area shows condylar part of occipital bone, you can see here, and then squamous part of the occipital bone, which is present. Can you see the squamous part of the occipital bone? I have outlined it here. Okay, and then third, the jugular foramen. I will show you the jugular foramen also. Can you see in the black? Yes, this is this black part. This is the jugular foramen. And the styloid process. Let me outline the styloid process of the temporal bone. This is the styloid process of the temporal bone. Okay. We will study about this process, styloid process, in later part of the video or in other video. Okay. And the fifth part is the mastoid part of temporal bone. Can you see this mastoid part which is outlined in green? This is mastoid part. So we are going to study about these structures in detail. First we will study the condylar or the lateral part of the occipital bone. Let me show you the condylar or lateral part of the occipital bone. Here you have the condyle which looks oval in shape. Occipital condyle are oval in shape and are situated on each side of the anterior part. Can you see it is on the anterior part of foramen magnum? Their long axis, can you see their long axis? See here, their long axis are directed forward and medially towards the midline. They articulate with superior articular facets of atlas vertebra. See, they articulate with, this articulates with superior articular facets of atlas vertebra to form Atlanto occipital joint. Yes, Atlanto occipital joint is formed here. See here, this is the hypoglossal or anterior condylar canal. Can you see the hypoglossal or anterior condylar canal? It pierces the bone in the anterior superior point to the occipital condyle and it is directed laterally and slightly forward. Let me show you. This is present on the antero superior to the occipital condyle. Can you see the occipital condyle? And it is superior and in the anterior part. And this is directed laterally and slightly forward. Can you see how it is directed? What is the direction? Okay. Now we will see the condylar or posterior condylar canal. It is also known as condylar canal, or you can call it posterior condylar canal, which is occasionally present in the floor of a condylar. Let me show you that part. See here, this is here, this is the condylar or posterior condylar canal, which is present behind the occipital condyle. Where is it present? It is present behind the occipital condyle. Please see here. This is, and opens into sigmoid sulcus. Yes, inside the skull, it opens into sigmoid sulcus. So where is the sigmoid sulcus? Let me show you. When you go inside the skull, let me fade this part. Let me fade this part. Yes, this part. Now you can see this part. This is known as, now the skull, the occipital part has been faded so that you can see that canal. Which canal? the posterior condylar canal. Can you see? So it is opening in which part? It is opening in the sigmoid sinus part. This is the sigmoid sinus, which is present on internal part of the skull, which is not visible externally. I have faded this occipital bone, so that is the reason you can see that sigmoid sinus which is present in the occipital bone. Yes or no? Okay. Now let's see the jugular process of the occipital bone. Let me show you the jugular process of the occipital bone. Here you have very small one. This is the jugular process of occipital bone. This, can you see the jugular process of the occipital bone, which lies lateral to occipital condyle and forms the posterior boundary of the jugular foramen. Jugular foramen is present anterior to this jugular process, and jugular process is a part of which bone? Occipital bone. This you have to know. Can you see how it is present in the lateral to occipital condyle and forms posterior boundary of jugular foramen? This is the jugular foramen part. Okay. Now we will discuss about the jugular foramen. Okay. See the jugular foramen. Can you see the jugular foramen here? This is jugular foramen, which the structure which you can see on the screen. This is the jugular foramen. Okay. It is large, elongated, and second point, it is petro-occipital suture, not fissure, petro-occipital suture. Petrous part of temporal bone and occipital bone are joining, and here you have the suture, and this foramen, jugular foramen, is present on the posterior part of or posterior end of petro-occipital suture. Please see here, petro-occipital suture. Foramen is at the posterior end of the petro-occipital suture. And the third point you have, can you see the jugular fossa? Jugular fossa is present here. This is known as the jugular fossa. Okay. And see what it lodges. Jugular fossa lodges the superior bulb of internal jugular vein. Can you see the jugular vein on the screen? Yes. And here you can see the superior. Let me mark this part. This is the jugular fossa which lodges the superior bulb of internal jugular vein. The bulb, can you see here? Yes. Now we will see the lateral wall of jugular fossa. It is pierced by, let me remove all this, and here, yeah, here you have mastoid canaliculus, then tympanic. Let me show you first the mastoid canaliculus. This is the lateral wall, and here on lateral wall it is pierced by a canal known as mastoid canaliculus. We will study about the structure which is passing through these canal. Okay. This is mastoid, and here you have another structure which is known as tympanic canaliculus. Can you see the tympanic canaliculus? Tympanic canaliculus opens on or near the thin edge. Can you see the thin edge here where it is opening? Yes, that thin edge of bone between jugular fossa and the lower end of carotid canal. Can you see the carotid canal and the jugular fossa? There is a thin edge which is present there, and there you have tympanic canaliculus. We will study about all the structure which is passing through those canals and canaliculus in a separate video. Now we are just seeing the landmarks and the foramen. Now here you have the styloid process. Can you see the styloid process? We are going to study about this styloid process in the separate lecture. What are the attachment, what are the things which is present here? This styloid process is the part of which bone? Temporal bone. Okay. Then here adjacent to this we have stylomastoid foramen. Can you see? Which is situated little posterior to the root of styloid process, at the anterior end of the mastoid notch. Here is the mastoid notch. This is the mastoid notch, and it is present, that foramen is present at the anterior end of the mastoid notch. Okay. Now where is the mastoid then? This is mastoid notch, and this part is known as mastoid. Let me show you. This is known as mastoid. Can you see? And can you see this mastoid is forming the lateral wall of the mastoid notch? Yes. So here we have discussed all the part which is present in the posterior part of Norma Basalis. So thank you so much for seeing or watching this video. You can send your comments, you can send your reviews, whatever you think, and what are the points or what are the topics you want me to discuss with you. I plan to make all the lectures of head and neck region. Okay, but if you want something extra regarding this topic, I will surely try to make those lecture also. So thank you so much. And one more thing, please like, share and subscribe my channel.